Hi, I'm Anna Burns. I'm the pelvic floor physical therapist here at Infinite Potential. Glad that you've decided to book an evaluation. I wanted to go through just a couple of things to think about before the first time we meet. Often I get clients that I ask questions to and they go, oh, I haven't really thought about that. So if I give you a few things just to think about, you don't have to have the answers, but just to get the wheels turning, sometimes that can be helpful in that first visit. So I'm going to ask you about your general health history. I don't need every last little detail, but just kind of think about, if there's any particular surgeries or injuries or medications that I should know. But also I'm going to be asking about pelvic floor issues too. So I'm going to be asking about your bladder. Whether you're coming to me for your bladder or not, I'm going to be asking, how much are you drinking? What are you drinking? How often are you going to the bathroom during the day and the night? Do you leak urine with any kind of activity? I'm then going to ask you about your bowels, everyone's favorite topic. I'm going to ask how often you have bowel movements. Do you have to strain? Do you have hemorrhoids? What's your fiber intake like? And we'll kind of go on from there in terms of anything else that comes up. And then I'm going to ask about pelvic pain. Pain can happen with men and for women, so I will ask about pain with sexual activity. For women, I'll ask about pain with a pap smear or a gynecological exam, pain with using tampons. And for both men and women, do they have pain with sitting? Do you have pain with some sort of other activity? And then I just want to know about you. What are the things that bring you joy? What are the things that you enjoy doing? Are you an exerciser or not? And we'll talk about your activity level. We'll talk about your sleep. We'll talk about what kind of stresses you have in life. And that way we can get a really good big picture, and that'll help us to educate us in terms of where we want to go in terms of treatment. So just be thinking about those things, starting to pay attention a little bit before you come to this first visit, and hopefully that will spark even more conversation once I actually meet you in person. I look forward to meeting you.